Welcome back to another video of anti-inflammatory diet and research evidence. So I would like to recap my previous video on anti-inflammatory diet 4 key elements. So in this slide, I highlight some of the anti-inflammatory diets. The most famous and popular one is Mediterranean diet. This diet consists of olive oil, especially extra virgin cold pressed olive oil, whole grain products, fruits and vegetables, legumes and nuts, fish and seafood. Other type of anti-inflammatory diets such as Nordic diet, Washoku diet and Jiangan diet, which also consist of local fruits and vegetables, local fish and different types of oil, especially the extra virgin oils. On the contrast, diet which are refined consist of refined grains and sugars, red and processed meat, high fat dairy products, high salt consumption, and artificially sweetened drinks. These diets could increase the inflammatory process, or otherwise they are pro-inflammatory diet. Now let us look at specific disease conditions. First is rheumatoid arthritis. A recent 2021 systematic review, where researchers included many individual studies and examined the available evidence on a topic, found eating an anti-inflammatory diet would reduce pain in people with rheumatoid arthritis when compared with other diet. Moving on to Alzheimer's disease and related dementia. Inflammation is strongly implicated in the development of neurodegenerative diseases like Alzheimer's disease and related dementia. And evidence from several research studies suggest anti-inflammatory diet such as Mediterranean diet, which we have seen earlier, which consists of olive oil, fish, fruits and vegetables, legumes, nuts, etc., might help to protect brain. Let us talk about cognitive impairment and dementia. A 2016 systematic review of 32 research studies showed an anti-inflammatory diet, again here it is Mediterranean diet, may be protective against cognitive impairment and dementia, or in other words, it decreases the risk of dementia and cognitive impairment. Another published study followed 1059 Greek people for 3 years and observed their diet. They reported those with greater pro-inflammatory diet, that is diet which increases inflammation, had an increased risk of developing dementia. Moving on to depression, inflammation has also been linked with mental health, with people eating diet which increases inflammation. They also experience more symptoms of depression. Diet is one of the fundamental elements of lifestyle approaches to managing anxiety and mental health. Let us examine the role of diet in the aging and reducing the inflammatory process. More broadly, a 2021 published article examined recent research related to anti-inflammatory diets and their effect on reducing inflammation associated with aging. It is found that compounds commonly found in anti-inflammatory diets could help alleviate the inflammatory process derived from diseases and unhealthy diets. So all these research studies pointing towards the beneficial effect of anti-inflammatory diet or food substances that can decrease the inflammatory process. In conclusion, inflammation is a major factor and is a link between diet and many health conditions. Eating an anti-inflammatory diet is considered safe, likely to support health and to prevent future chronic conditions. These are some of the references I have used. If you find this video useful, please like, share and subscribe.